Hi, hello, welcome back to my channel. I'm your Rosie. Today we are going to discuss second part. So these are very important questions. When I wrote exam, these are the questions which I got in my exams. Okay, today we are going to see first question. Question number 1. Young patient arrived to the emergency department with burns in left arm. The patient weight is 48 kg. How you will calculate the fluid requirement for the patient according to the Backlund formula. This is a formula which I given here. So when you calculate according to his body weight, you will get 1728 ml. This is a formula. You can divide it first to 8 hours and 16 hours. 50% you can divide it. Question number 2. A 30 years woman with type 1 diabetes mellitus received mixed type of insulin in the morning and before bedtime. She reported that the level of her fasting blood sugar is constantly high when she checks every morning. Which dose of insulin is mostly causing the problem? So here we can see option A is low morning regular insulin, option B high morning NPH1, option C high evening regular insulin, option D low evening NPH insulin. The answer is option D. Question number 3. A nurse in the postpartum unit is caring for the patient who had just received a newborn infant followed a pregnancy with placenta previa. The nurse reviews the plan of care and prepares to monitor the client for which of the following risks associated with placenta previa. Option A, disseminated intravascular coagulation. Option B, chronic hypertension. Option C, infection. Option D, hemorrhage. Answer is hemorrhage. Question number 4. In the summer month, a 5-year-old girl presented with a sore throat and a dry cough that has slowly become worsened over the past 3 weeks. Her body temperature is 38 degrees Celsius. On auscultation, there is wheezing and shortness of breath. She lives in a overcrowded house with 3 brothers, parents and grandparents, and in a low income neighborhood where she attends the school. Which is the greatest risk factor? Option A, residing in a low income neighborhood. Option B, exposure to a pathogen in summer season. Option C, attending school. Option D, living in crowded condition. Option D, living in crowded condition is correct answer. Question number 5. Which of the following is described as premature separation of placenta, normally implanted placenta during the second half of pregnancy, usually when with severe hemorrhage? Option A, placenta previa. Option B, ectopic pregnancy. Option C, incompetence cervix. Option D, abruptio placenta. Abruptio placenta is the correct answer. Question number 6. A patient reports the onset of vaginal discharge that is copious, formally, foul smelling and yellowish green color. Which organism is most likely causing the symptom? Option A, Candida albicans. Option B, human papillomavirus. Option C, Tryponomus pallidum. Option D, trichomonas. Option D, trichomonas is correct answer. Question number 7. 28 years old married woman is admitted in the gynecology ward for the observation after her miscarriage. She has not been able to sustain any pregnancy since she got married for past 3 years, and she had 3 miscarriages during this time. What intervention is the most appropriate? Option A, family history. Option B, past medical history. Option C, physical examination. Option D, laboratory investigation. Option B, past medical history is correct one. Question number 8. A patient came to the emergency department with hypothermia and doctor ordered to give aspirin 50 milligrams. After 2 hours, they checked temperature and found high, that due to non-absorption of aspirin. What is the cause for this problem? Option A, short time of duration. Option B, inadequate dose. Option C, high acid in stomach. Option C, high acid in stomach is correct one. Question number 9. When administering albuterol to a child with asthma, the nurse should observe the signs of what major side effect to this medication? Option A, tachycardia. Option B, renal failure. Option C, apnea. Option D, blurring of vision. Option A, tachycardia is correct. Question number 10. A nurse is performing an assessment of a client who is scheduled for a cesarean delivery. Which assessment finding would indicate the need to contact a physician? Option A, blood pressure is 128/76. Option B, white blood cells count of 12,000. Option C, oxygen saturation is 96. Option D, temperature 37.2 degrees Celsius. Option B, white blood cell count is 12,000. That indicate patient has some infection. Thank you for watching the video. Kindly subscribe and share the video. Thank you.